Happy Sunday, everyone, and welcome to Doctors on TV. I'm your host, Dr. Sarah Barba-Cabodil. It's a day for new learnings. And for today's episode, nais naming magbahagi ng kwento ng buhay ng isang breast cancer survivor. Kamusta kaya ang kanilang buhay pagkatapos ng pakikipaglaban sa cancer? At para po sa mga detalye, panoorin po natin ito.
Na-diagnose ako 2012. Na-diagnose ako because after a trip in the US, pagdating ko, nagbabasa ako ng book na never ko namang ginawang dumapa sa bed. For some reason, naisip ko lang dumapa. And then pagbangon ko after reading, yun, may napansin akong secretion sa left breast ko na reddish-brown fluid. So medyo nag-alala na din ako noon at that time. So nagpa-check agad ako sa doctor ko. I had mammogram. And then after the result ng mammogram, ni-refer agad ako for biopsy. So kinabahan na din agad talaga ako at that time. And then nakuha ko nga yung result ng biopsy. I was diagnosed, confirmed, positive of stage 3 breast cancer. Prior to 2012 na may nangyari nga ganon sa breast secretion ko, may nararamdaman na ako mga bukol. But nung pina-check ko siya, few years back, sabi sa akin fibrocystic lang daw. So nothing to worry. So because nothing to worry, although dapat pinapa-check ko pa rin, may naramdaman akong bukol. Pero in-assume ko na yun, fibrocystic lang siya. And then before nung 2012, 2011, talagang ugali ko naman nagpapa-general check-up, annual general check-up. But I think at that time, because wala pa akong 40 and hindi ko rin na-disclose na may cancer history kami sa family. So wala akong mammogram. Had I included mammogram sa annual check-up ko because may history ako ng cancer, siguro na-detect ng mas maaga yung breast cancer ko. Hindi ko na siguro kinailangan mag-chemo ng matagal. So ayun, yun lang siguro yung I could have done para naiwasan yung stage 3B agad na diagnosis ng cancer ko. Hindi talaga, hindi ko naisip. Yun na nga kasi walang kulang sa awareness about breast cancer na kapag may mga ganong bukol-bukol, ganyan dapat pinapacheck. Unlike ngayon, sobrang shock ako. Actually, in denial ako at first, shock, and then after a while, parang wala ako sa sarili ko. At that day, ito yung sinabi ng doctor ko na na-diagnose ako ng stage 3B. Hindi ko alam yung gagawin ko. Naglakad-lakad ako sa isang mall. Hindi ko alam. Ikot-ikot ako. And then, napunta ako sa isang church. So, I just attended the service. Kinig lang ako. Iyak ako ng iyak. Sobrang iniyak ko talaga ng iniyak. And then, after that, I talked to the head ng church, nagpa-pray ako, and then they connected me sa mga parang a Bible study group. Yun, that's how I started. Pero talagang in denial ako. After kung malaman yun, sabi ko, Lord, kung time ko na. May konting yabang na, kung time ko na, okay lang, time ko na, Lord. Sige, bahala ka na. That was my attitude few days after. So parang in denial, hindi pa nagsisink in. I think it started to sink in nung nag-umpisa ng maglagas yung hair ko. After ng first chemotherapy, second chemotherapy, may mga hair fall na sa pillow. So doon na nag-start, slowly nagsisink in na sa akin. Lalo na nung kinailangan ko na magpa-shave ng hair. Totally, kalbo talaga. After nung sinishave yung hair ko, first time ko nakita yung itsura ko na kalbo sa mirror. Sabi ko, kumanon ako. Napaganyan ako. And then I started to cry. Doon nag-start mag-sink in na, I have cancer. Hindi ko na siya ma-deny sa sarili ko na this is it. Ganun pala. Because cancer is cancer. Whether stage 1, 2, or 3, or advanced stage, it's cancer. Alam natin na anyone can die. Depende kung paano natin naharapin. So, yun yung first part ng journey ko. So, after nung na-shave na yung hair ko, I started the treatment, chemotherapy. Biglang bumagsak yung katawan ko. I think, on the third, hindi kinaya nung katawan ko eh. Because I developed an infection from the core biopsy And nagkaroon din ako ng, bumagsak talaga yung katawan ko. Nagkaroon ako ng mouth sores, so nahirapan akong kumain. Nahirapan akong kumain to the point na kailangan i-blender yung mga food ko. Kakain ako gamit lang straw. Straw lang talaga. So, because of that, bumagsak talaga yung katawan ko. And then, pag magsha-shower ako, may assistant. So, after ko mag-shower, I remember, every after shower, I would cry. Kasi, doon ko lang nakikita, after ng shower, pagbukas ko ng shower curtain, mirror yan eh. So, makikita ko na naman yung kalbo na itsura ko. I think it's because wala na akong hair. Diba, pag cancer, automatic, naiisip mo kalbo. Pag kalbo, may cancer. So ako, hindi ko na siya ma-deny. Every time makikita ko yung itsura kong kalbo, I would cry sa mirror. Kakry talaga ako. But I remember, every time din, madrama, maglilin ako sa pinto. Sasabihin ko, Lord, kaya ko to. Kaya natin to. So, it will make me feel good. Pero, after, kasi naka 22 cycles of chemotherapy ako eh. So, 3 sets, bale. I rested after the second set and then another set. So, patapos yung first set, bagsak na talaga yung katawan ko. Because of the infection na hindi sinabi sa akin ng doctor ko. I could have died pala doon sa infection na yon. So pasintabi sa mga kumakain. So, parang ganito yung butas. Tapos may lumalabas na parang condensed milk. Even the color, ganun. So, nakahiga ako. I remember one time, sobrang putot balat na halos ako dahil hindi nga ako makakain. Nangitim na yung mga, kamay ko, pati mga ugat-ugat ko. So, nakahiga ako. Umabot sa point na hindi na ako makagalaw. Hindi talaga ako makagalaw. And then, na-alarm ako. Yung yabang ko, na Lord, kung time ko na. At that time, nagpakatotoo talaga ako kay Lord. Because I thought, anytime, babagsak or mag-stop na lang yung vital signs ko, vital organs ko will just stop performing. So, naisip ko yung mga anak ko. I have 2 kids at that time. I think they were 13 and 15 at that time. So, bata pa, di ba? And I'm a single mom. So, sabi ko, hindi ako makagalaw. Kasi hindi ko makagalaw. Sabi ko, Lord, mamamatay na ba ako? So, I prayed. Sabi ko, Lord, please heal me. For my kids, extend my life kahit hanggang makagraduate lang yung mga anak ko. 2012, I was diagnosed. So, I stopped yung last chemo ko after 5 years. Medyo matagal because of the infection. And then, marami kasing complications sa katawan ko. So, tapos na yung second set. I rested. Then, meron pa akong booster chemotherapy. So, after 5 years, 6 years, dineclare ko na. Although tinapat ako ng doktor ko na wala naman din daw talagang cancer-free kung iisipin. But ako lang talaga sa sarili ko. After nung nag-stop na po yung treatment ko, I declared myself as cancer-free, as fully healed. And then, nag-10 years ako, 2012, ako na-diagnose. So, 2022, last year, I celebrated my 10th year anniversary as a breast cancer survivor, declaring and praying that I am cancer-free. So, since that day, hanggang ngayon, God healed me. God answered my prayer. And at this time, graduate na yung mga anak ko. They're both working. So sabi ko, wow, Lord, you answered my prayer. You extended my life. May bonus pa. Kasi graduate na yung mga anak ko. Now, I considered my life now as a bonus. So, taglay ng buhay ko, make every moment count. Because I do make every moment count now. I try to live a life that's honoring God, that's pleasing to God. Because I know someday we will pass, we will still go, diba? To the eternal life. And when that happens, I want to make sure that I'm prepared. So, yun yung struggles and victory ko. For those women na meron ding fibrocystic diagnosis from their doctor, it's good because it's safe. Diba? Hindi siya cancerous, but kailangan ding i-monitor. Dahil bukol yan, just like what happened to me, na interpret ko siya or napagkamalan ko siya na fibrocystic, bukol na pala. So, for example, may nadagdag na bukol, hindi gaya nung kung kailan ka na-diagnose ng fibrocystic. So, you have it checked. Regular check-up pa rin, important. And of course, why do you have to do that? Why do you have to undergo breast examination or even mammogram? Whether natatakot ka o hindi, I suggest you have it done. Do it. Why? Because dun lang madidetect yung stage o yung kung meron o wala. 'Di ba? Mas mabuti nang may peace of mind ka, alam mong wala, or kung meron man, matreat agad. Kesa hindi mo gagawin yung treatment dahil masakit. Let's say mammogram, dahil sabi nila masakit. Pero, mas masakit kung mas matagal kang magtitreat, especially madadiagnose ka ng advance. So I encourage, whether masakit o hindi, alam ko may mga bagong machines na ngayon na hindi na daw masakit. So wag nang isipin kung masakit o hindi. Just go do it. Have the mammogram done to prevent or even cure, diba? Kung ano mang meron dyan because of advanced diagnosis. Para po sa lahat ng kababaihan na na-diagnose ng cancer at kasalukuyang dumadaan sa laban, no? Araw-araw na laban. Ang unang advice po na mabibigay ko is strengthen your faith. Talagang faith na in ourselves, sa sarili nating kakayahan, but faith in God first and foremost. Kasi totoo po yun eh. With God, nothing is impossible. When you say nothing is impossible, even cancer can cripple love. Cancer can cripple the love of God to us, diba? So, have faith. Talagang mag-seek tayo kay Lord kasi hindi ko po masasagot yung mga katanungan nyo bakit. Ang masasagot ko lang buhay ang Diyos at ano man ang mangyari, hindi niya tayo pababayaan. Okay, so second, surrender. Kasi nung journey ko, that's what I decided to do. I surrendered to positivity. I surrendered my life to God. I surrendered. Kasi parang hirap na ako dun sa pinagdadaanan ko. I realized, on my own, hindi ko pala kaya. When I surrendered and I trusted that from the crown of my head to the soles of my feet, I am healed. No, that's a sign of surrender. Surrender to doubts, surrender the doubts, the anxieties, the worries. It made my life, my journey easier. Of course, there will still be attack of worry sa gabi. Pag wala ka ng kasama, diba? Sabi nga nila, battlefield is in the mind. So, it's really a daily fight. So, kailangan po talagang labanan. So, surrender natin lahat yan. Kapag hindi na kaya, yung negative thoughts, surrender it to God. Lord, hindi ko na kaya. Bahala ka na. Coupled with faith, it worked. And then last, be happy. Sabi nila, paano maging happy? Nagtitreat ka nga. You know, a grateful heart, a positive heart can still be joyful even in the midst of trouble, even in the midst of the journey. Because I was able to experience that, although later part na. So, kaya naman po. Hindi ko po sinasabi na, we will always be joyful habang nagtitreat, diba? Mahirap yun eh. Pero kapag in our mind, alam natin that we can choose happiness always, it can be done. Look around, look at your family, look at what you have at home, look at everyday blessings na pinaprovide ni Lord and be thankful. It can be the source of joy even though you're still fighting cancer. So, laban lang po. Kasi sabi nga, every gising is a blessing sa amin pong mga cancer warriors. So, pag gising mo sa umaga, victorious ka na from the past day challenges. So, be thankful, be grateful. And madalas po, nakakalimutan natin yung pinaka-importanting blessing pa sa atin. The life itself, the fact that we're still breathing, we're still alive. There's hope. There's hope. Hindi po natin hawak yung mga dadating na araw. Sabi ko nga, only God can put a period in our life. So hanggat that pa yan, ibig sabihin humihingi pa tayo, hindi pa straight line, there's hope. So have faith, surrender everything to God, and choose happiness always. I am Lane Constancio. I make every moment count and celebrate life now with gratefulness and love. I am saved by God's grace and healed fully by our Lord Jesus Christ. I am a breast cancer survivor.
Nakakatuwang mabalitaan na may mga ganitong klase ng stories na maaari nating kapulutan ng aral. Sa likod ng mga kwentong may bigat ngunit patuloy na lumalaban sa kanilang buhay. Kaya't nowadays, prioritizing a healthy lifestyle and praying to God should be at the top of our list. And before we go deeper, we would like to invite you to follow and subscribe to our social media accounts. Please like and follow our Facebook page at www.facebook.com/DrZonTV and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions and comments po sa mga pages na yan. Naku, kaya after liking and subscribing, i-share nyo na din po sa inyong family and mga friends. Naku, marami pa po tayong pag-uusapan mamaya, kaya wag niyo pong ililipat ang channel. Doctors on TV, we'll be right back. Welcome back mga kasangbahay! Naku, bago po tayo dumako sa ating bagong talakayan, ating balikan ang mga naging unang talakayan natin dito sa Asian Breast Center. For the recap, let's watch this. Doc Norman, are these patients pre-scheduled or can they just come walk in?
Yes, every patient who walks in here should be scheduled ahead of time para hindi naman sila po naghihintay. Dito we try to respect their time, and obviously the time ng pasyente is just as important as our time.
Yeah. So yan mga kasangbahay, dapat at the age of 40 is advisable na every year ginagawa. Maganda po yun, at least, di ba, meron tayong peace of mind, okay?
Now the thermolytics that uses heat to create images, and the images are interpreted through the most intelligent, the best radiologist in the world, and her office is in the clouds. Ano ang pangalan niya? AI, Artificial Intelligence.
Ngayon naman mga kasambahay, ang pag-uusapan natin ay what are the things that we don't know about breast cancer? At para malaman po natin ang mga sagot dyan, makakasama pa rin natin today, of course, ang isa sa mga founders ng Asian Breast Center. Let us welcome Dr. Norman San Agustin, a general surgeon and also a breast surgeon from Asian Breast Center. Good morning, Doc Norman, and welcome back to Doctors on TV.
Good. Thank you very much for having me here. At magandang umaga po sa inyo lahat nakasamang bahay.
Yan, and of course, I'm looking forward, Doc, no? Marami na naman tayong tatalakayin. And of course, this time, ang ating topic would be the things that we don't know about breast cancer. Nako, this is very interesting again, okay? And siguro ito panimulang katanungan, Doc, no? Can you discuss the anatomy and physiology of the breast? So, maganda para at least pas ma-identify ng ating mga kasangbahay kung meron silang abnormality na na-experience kapag alam nila kung ano yung normal muna. Okay, so ano po yung normal anatomy and physiology of the breasts?
Well, the breast was intended primarily to produce milk, so it's a milk factory if you want to call it that, ano? Paggagawa ng gatas para sa welfare ng mga bagong panganak na mga anak nila, no? At that's exactly what it is, you know. It's made up of factories they call lobules, and those lobules are divided to smaller lobes. It's actually lobes and then lobules, and each of those lobules are attached to ducts. The ducts bring the milk from the factory to the nipple, at doon ang source ng nourishment ng mga bagong pinanganak. Pag nagka-develop ka na kasi, nagagaling dito yung sa mga factories, yung mga lobes, lobules, ducts at ductules. At yung nagsusuporta dito that hold them in place are what they call the parenchyma, or the fat and the fibrous tissue. And the size of the breast does not depend on the amount of lobules. It depends on the amount of fat and fibrous tissue. Kanya yung malalaking breast na double D, triple D, the milk that they produce is the same amount of the cup A and the double D.
Okay, kasi Doc, maganda mention mo yan. Merong conception, or should I say misconception, na kapag mas malaki ang breast, mas malaki yung ability of of it in producing milk. So basically, so that's a misconception, Doc, no? And yung ni-mention niyo po, yung diniscuss niyo with regards to the physiology or the function of the breast. So does this hold true for the female breasts alone or pati sa mga kalalakihan? I mean, I'm sure gusto natin maliwanagan po ang ating mga viewers, particularly yung mga kalalakihan. So, kamusta po ang, how about sa anatomy and physiology of the male breast? So, pareho din po ba sa mga kababaihan?
Oo, palelo yan, ano? Babae, lalaki. The only thing is with the male breast, hindi na di-develop yung mga, nagiging
Primary tissues.
paumpisa lang yung breast tissue. At obviously, because they don't have estrogen and progesterone, hindi na stimulate itong mga glands na ito at hindi nagpo-produce ng milk, ano?
I see. Okay. So, that's the normal breast, no? So, sabihin, normal yung kanilang anatomy and normal physiology. But when we talk about breast cancer, so ano po naman ito? Okay. So, just para lang alam ng ating mga kasangbahay, no? Na parang, teka muna, ito ba ay breast cancer na meron ako ngayon? Ganito.
Well, are you referring to at which point should they go see a doctor? Or,
Yeah. I mean, probably siguro for now, we just define what breast cancer is.
Okay, well, when you look for signs and symptoms of an evolving breast cancer, first of all, you waited too long, because you're supposed to see the doctor for checkup even before symptoms. In fact, we encourage you to see doctors based on the recommendation by the NCCN guideline, National Cancer Institute, when to have your breast checked up, which is, if you're a female, if you're from the Philippines, you grew up here, that you should have your breast checked. You should be checking your own breast from the time you develop buds in your breast, and when you reach the age of 35, you should have your baseline mammogram. Depends on whether you have family history or not, and what your Gale score is. Patapos definitely at the age of 40, you should have your breast checked on an annual basis, meaning a mammography at least, and whatever other test needs to be done as recommended by your breast surgeon. At the age of 35, kung pwede, kung ma-afford niyo, magpa-breast mammogram na po kayo. At pagdating nyo ng 40 years old, you should do it every year from there on.
Yeah, but in the event na parang whatever the inhibitions, bakit hindi nakakapagpunta sa doctor? So, in the meantime, ano yung pwede po nilang gawin muna sa
breast self-examination from the age, from the time meron ng bud and lumalaki na yung from the nipple to actual breast formation, they should be quite aware of their own anatomy. The parents should know how to teach, lalo na yung mother, kailangan marunong magturo ng anak nila kung paano gawin ito. At eventually, when they get to be grown up at the age of 35, they should see a doctor to get a full examination and learn how to do a breast self-examination.
I see. Okay. So you mentioned about na breast bud po, no? Ibig sabihin, pagpasok pala ng adolescence period, maganda nagsa-start na sila. So may familiarity sila dun sa normal anatomy nila.
That's right.
Okay. And when we talk about self-breast examination, paano po ito ginagawa? Ano po yung proper way? So just we can educate our viewers.
Numerous ways to do a breast self-examination. The way Asian Breast Center does it is that we ask the patients to do the examination usually 2 weeks after the first day of the last period. In other words, kung period nyo itong araw na ito, let's say today is the first of the month, you do your breast self-examination 2 weeks afterwards, which will be on the 15th. If your period is on the 15th, then you should do it on the 30th. Maghintay kayo ng 2 weeks kasi if you do your breast self-examination on the day of your period or just before or after your period, marami kayong mafe-feel ng mga bukol po dyan na hindi naman talagang nawawala yun after 2 weeks. So to save yourself, spare yourself the anxiety, try to examine yourself best after your period, 2 weeks after the first day of your last period. Pagkatapos po ninyo, always remember, you always use the opposite hand. So right hand examines the left breast, left hand examines the right breast. Cross, cross. Opposite hand, always do it this way. You do it standing up in the bathroom and lying down in bed. Same day, may examine ka. So
you have to do that in different positions, okay? Just like when you're
standing
standing,
up and lying
saka
down.
nakahiga, okay.
Pag nakatayo ka, dab yourself dry sa banyo, magpatuyo kayo. Pag tuyo na kayo, titingin kayo sa salamin at itataas nyo kamay nyo. Let's say, yung left breast una, tataas mo yung kamay nyo. Using the right hand, examine your breast, You can do it in circular fashion, going from the center towards the periphery, or what I normally do is examine from the top to the bottom, with the whole hand, parang general scanning, upper breast, mid breast, lower breast, Magsisimula sa kilikili, parang going across to the sternum, yung breastbone. Pagkatapos doon, after yung 2 fingers, I have to do it the whole hand, 2 fingers na lang, focus. So ngayon, 6 levels, upper breast, mid breast, above the nipple, across the nipple, below the nipple, Kapag natapos na lahat yun, yung 2 fingers goes to you, tickle, put your arm down and feel for any kulani, After the kulani, now your hands are in the perfect position, your fingers in the perfect position. Nasa upper breast ka, nasa kilikili ka. So therefore, you go across again to the upper breast, mid breast, above the nipple, across the nipple, below the nipple, lower breast. Alright? So tapos na yun. Pagkatapos ng last movement dito is the nipple itself. Pipigay mo yun from top to bottom, side to side. Kung may lumabas na fluid, particularly if it's bloody, then you can be in trouble, or you need to come and go and see a doctor immediately. Yun na.
Okay, and that has to be done daily?
No, don't do that. No, that's a big mistake. Do it only once a month. And I'll tell you why. Let's say your grandson or granddaughter comes and visit you. Anong una sasabihin mo pagkatapos mo hindi mo nakikita ng 2 buwan, 3 buwan? Oh my grandchild is now so big. Lumaki na. Tapos yung mother titingnan, looks the same because you see your child every day, di ba? Kung hindi mo nakikita ng 1, 2 buwan, parang lumaki na kagad, you can see the difference, It's the same way with breast masses, You get so familiar with it if you do it 2 or 3 times a day or every day, you start to miss the subtle changes. So it's best for you to do it every month, once a month, mid-cycle,
I see. Okay. So, yan napaka-importante, Para kung kunyari may nakita tayong changes, hindi natin intayin na malala siya. Okay. So, early on, mapakonsulta mo na kung kunyari walang pagbabago, Despite, so kung mayroon mga nakitang may nakapapodok, and syempre pwede nilang ulitin after a month yung kanilang
in fact, that's a good advice. Don't panic. If may nakifeel ka, usually, particularly mga cysts na yan, minsan dumarating na wala, So, pag may na-feel ka, huwag ka muna mag-panic, You wait another 2 weeks to do the self-esteem examination. Kung nandun pa, mas malaki, and then you wait another 2 weeks, at nandun pa, mas malaki pa lalo, call the doctor.
You will see the doctor. Okay. Ito, Doc, ano ba yung mga risk factors para magkaroon ng breast cancer ang isang individual?
Risk factor, good question. Yung mga taong naghihintay ng familia magka-breast cancer muna, sila mauna bago ako, are making a big mistake. Because only 20% of women will have family history. 80% yan, walang familyang member na nagkakaroon na meron ng cancer. So don't wait for somebody else to be first. You will be maybe that first person. The other thing is sort of alluded to before, yung menstrual cycle, birth control pills, maybe it increases it, but the important thing is yung hiksiyan yung exposure ng breast mo sa estrogen and progesterone. There's things that you can do, some things you cannot do, Kasi early pregnancy, prolonged breastfeeding, at least 1 month, ng 1 year. 6 months, mas okay din 6 months. But 6 months and up, just perfect, Again, what that does to it, stops your menstruation during the time you're breastfeeding. So, nangyayari, nadidelay yung exposure ng breast mo to estrogen. And then, immediately get pregnant again, and then, again, the same process.
I see. And here in Asian Breast Center, so what are the equipments that you usually use specifically for breast cancer?
Well, we use the standard one, which are mammogram and ultrasound. I just want to give a word of awareness to a lot of people. It's like if you want to eat French food, you don't eat it in the carinderia. You have to really go to places where that's all they do, and that's they're expert in that particular field. And the reason why I say that is because you can have a very good mammogram, but if you don't have a good radiologist to read it, then it's very operator dependent. It's also very machine dependent. That means kahit ang galing doktor mo, kung pero masama naman yung equipment mo, hindi rin makikita, So if you're gonna do it right, go to a breast center that has good equipment and good doctors specializing in that particular field, At medyo accurate po yung magiging makukuha niyo resulta, hindi yung para mo nerve negative, hindi naman pala negative. Yung sa amin, we have, it's actually yung other, yung kasabihan ng mga matatanda. ay, huwag ka magpamammogram kasi masakit na masakit na masakit. You know? But people really don't understand what they're doing. If ito talaga masakit, it's either mali yung machine na ginagamit o hindi ta properly trained yung radiation technician ninyo. Because if you do it right, it really should be painless, or minimal discomfort. Kaya ang importante dito, that you go to a place where they have modern equipment. Yung digital po ngayon, hindi na kamukha ng lumang analog. Yung analog, medyo pinipiga talaga para luminaw yung picture ninyo. Yung new 3D and 2D mammograms, not only is it clear, but more importantly, they have a pressure control. Ang ibig sabihin nun, kahit na galit ka doon sa babae, hindi pa masakit, sige na, sige. Yan na, aray! Pwede tigil yung you can't do that, Yung mga bago ngayon, meron silang pressure monitor. Pag dumating ng pain level, it stops kahit na gusto mong i-press, hindi na pwede.
So automatic siya, apart from its high sensitivity.
And then there's another thing that I want to warn you, and please, I want to tell this, thank you for this opportunity to say this. In the Philippines, not too many people still talk about the density of the breast, importante yung density. So United States, a few years ago, they made a law based on the different states. Ngayon, it was so important, they made it a federal law na part of your examination reading, you should interpret the density of the breast, A, B, C, and D density, Ang pag D density, not only is it difficult to read them, kasi the early signs of early breast cancer is really microcalcifications, mga dots lang. Kung dense ang breast mo, maputi, tapos hindi mo makikita yung puti, white on white is very difficult to determine. Ang other problem doon, pag dense ang breast mo, you have higher incidence of breast cancer. So that in itself is a factor. Now there is a machine called the one that we use is MBI, molecular breast imaging. Dito MRI, magnetic resonance imaging. Ang problema sa MRI na available dito, ginagamit nila gadolinium. Gadolinium, once it's injected, you never excrete it. It's stored in your brain, and they don't know what the long-term effects are. And it could be nephrotoxic, pwedeng sirain yung kidney mo. Kaya you also order as a creatinine in the UN. Or just creatinine. Ang problema ngayon, hindi na excrete, medyo mas mahal at hindi alam natin ang long-term effect ng MRI. Versus the MBI, molecular breast imaging, which uses sestamibi. Sestamibi is the contrast that they use for stress tests for elderly people. So ang ganda doon, once it's injected, you go to the bathroom, you pee, it's gone forever. So it has no long-term effect, does not affect your kidneys, you don't have to get a BUN and creatinine for your procedural.
Yeah, kasi that's the sad part. Of course, mas nakuha mo nga yung, na-diagnose mo nga yung sa breast, pero you have like a problem naman ng kidney problem. For now, yan muna, Doc Norman. Maya-maya po, idudugtong naman natin yung mga patient procedures ng isang may suspected breast problem, or should I say, breast cancer. Pero sana hindi naman, Naku, kaya mga kasambahay, dyan lamang po kayo, magbabalik po ang Doctors on TV. At para pa rin po sa pagpapatuloy, kasama pa rin natin si Doc Norman San Agustin, a general surgeon and also a breast surgeon and one of the founders of Asian Breast Center. At ngayon naman po ay pag-uusapan natin kung ano nga po ba yung mga treatment options nila dito sa Asian Breast Center. Okay, Doc, So ito nga po, kapag na-diagnose ang isang pasyente, of course, whether sa inyo po, kayo po ang nakadiagnose with all the diagnostic procedures that you have here in your center, or kung galing man sa labas, okay? Kung kunyari diagnose sa labas, sometimes nagpapaulit pa ho ba kayo ng mga diagnostic measures, just to confirm?
Well, we're sort of in between, Kasi sa America, when you go to prime breast centers, let's say Sloan Kettering, they will not respect or accept any diagnosis na hindi nang galing sa kanila, And very often, bibigyan din papeles na, okay, but we'll have to repeat the mammogram, we'll have to repeat the biopsy, we'll have to repeat everything, Dito naman, ang problema malaki dito, yung pagka-brilliant mo, pagka-idealistic mo, you have to temper that with the fact that hindi Amerika ito, hindi ito maraming pera, walang mga insurance mga tao. And kung hindi sa minamata mo yung mga malilit na hospital. But if there's any question, any doubt, you really should repeat them. Pero kung nakikita mo, may ulcera na, malaki na talaga, you do your very inexpensive ultrasound, nakikita mo concurrent or concordant yung report mo, na binabasa doon at yung nakikita mo, those usually we try to avoid repeating them. Kasi may halaga rin yung nakakaawa ng may pasyente. So we have to use clinical judgment. Kung mukhang normal na normal, sinabi nila tanggalin mo yung breast, obviously hindi namin gagawin yun, ano? So we do our own clinical judgment, which is not directly responding to your question, but it's very important for me to underscore this, you know. Yung problema, nakikita ko rin, malaking problema is excisional biopsy, no? Yung para malaman mo kung anong diagnosis, yung mga kutsilyong ginagamit ng ibang surgeons dito na it's sometimes rarely indicated. Normally we use a needle lang naman, ultrasound guided needle core biopsy is a way to establish a diagnosis. It's cheaper, it's less traumatic, it's less invasive. You get the same result, and most important of all, you don't burn your bridges, Kasi ang treatment sa America, which goes along with your question, line of question, ang treatment modality in most institutions of states is really breast conserving therapy, Do as much as you can to preserve the breast. Don't be so aggressive in actually saying, tanggalin mo lang yung breast. It's an easier procedure. It's a lot easier. In fact, it's faster to do than a lumpectomy, believe it or not. But the thing is, we put a lot of importance in aesthetics, nakikita. Kung tatanggalin mo yung breast, hindi naman kailangan tanggalin, hindi namin tinatanggal. So we do breast conserving therapy. And sometimes excisional biopsies using a knife burns or bridges them. Minsan, pwede naman i-preserve yung breast. Ang nangyayari na you're forced to remove the breast unnecessarily, But anyway, yun ang, in terms of management, there are 4 treatments to breast cancer. One is surgery, the other one is chemotherapy, the other one is targeted therapy, and the other one is just hormonal therapy,
So all these are being offered here in your center, Doc?
Oh, everything. We're a very, very comprehensive program. Soup to nuts, we do everything, including post-operative care, which is so important. People forget that. It doesn't end with a knife, Yung holistic medicine is so important again. I just can't overemphasize that.
Okay, so tama ba yung understanding ko, Doc, na parang mas advocate kayo ng mas, if kaya naman na conservative, okay, ang approach, you go for that more rather than go aggressively?
Tama yun. Don't make the mistake of giving patients options where there shouldn't be options. In other words, kung advanced na yung cancer, hindi mo naman sabihin, kayo lang, gusto nyo tanggalin lahat o hindi tanggalin. This. No, if it's an early cancer, tell them there are 2 options. One is to remove the entire breast or to take part of it out. In other words, breast conserving therapy or total mastectomy. Pero ang importante sa lahat, there are certain types of cancers that they should not have a breast conserving therapy. But it's a general rule. Ang pina-follow ko, and this seems to be the trend internationally, if you can preserve the breast any way you can, then that's the way you should go. In fact, one of the things ginagawa na ngayon, what they call neoadjuvant therapy. In other words, if you have a borderline sized tumor, in other words, let's say 3 or 4 centimeters yung tumor mo, and then you have a breast that's a cup A, rather close to the nipple, then what they sometimes, but it's a young girl who's attractive but never been married and would rather die than have her breast removed, then you can sometimes attempt, in certain instances, there are many factors that we don't have time to talk about, but yung mga ganito, sometimes you can give them neoadjuvant therapy to shrink the size of the tumor, and then if you feel it's safe, then you can do a breast conserving therapy instead of a total mastectomy. Pero try as much as you can to conserve the breast. And just as a corollary to this, ang masama dito, yung people think the more you remove, the better it is for you. That's not so. It depends on a lot of factors, Pag ang doktor mo magaling, sinabi sa'yo, you have these choices, then don't worry, there is no wrong choice then, It's just a matter of what you prefer. Pero kung ang doktor mo nakakaintindi talaga, hindi niya bibigay sa yung option na pag mali ang sa pili mo, mamamatay ka, No. Pag pinabigyan ka ng pili, it's either choice A or B, then that means if you live or die, it doesn't depend on your choice. It depends on whether yung prognosis mo depends on the tumor size and the type of tumor that you have,
I see. Okay. So basically, yung sinasabi ng iba na kapag hindi tinanggal yung buong breast, babalik, paulit-ulit lang. So basically, it's a misconception, Doc. And of course, the management, the approach that you go for here at Asian Breast Center depends on the stage, okay? Kung ganong kalala ba ang condition ng isang pasyente. Okay, and okay, Doc, so do you have like any final words for our viewers? Para at least kahit paano maging mas at peace sila when when they think of when they hear about breast cancer, kasi usually nagkakaroon ng stigma na lalo na naku si mama may ganito, so parang takot na buong family, and then lahat nasa stress na, especially kung kunyari nangyayari po kasi 'di ba both sides, o kaya sometimes sa isang side lang ng family meron din, parang lahat nagpapanik na sila eh.
No, the important thing to remember, and I've mentioned this before, importante sa tandaan nyo, ang breast cancer po, hindi death sentence yan, hindi mamamatay ka na, no? And that's a very wrong notion. Just wipe it out. Tanggalin mo sa utak mo yun, ano? Just because may cancer kayo sa breast, mamamatay ka, hindi po yun, ano? Importanteng bagay lang pong tandaan ninyo na para hindi kayo mamatay at madali ang paggagamot niyo at murang paggagamot, go for your early screening, ano, and breast cancer risk reduction po, ano? Yung konting in-invest po ninyo sa pagpunta sa mag-usay ni doktor, ang magandang payo niya sa inyo, it goes a long way, no? That's the right way to spend, no? At when you reach a certain age, patingin kayo sa doktor, at pag nagka-problema kayo, patingin sa doktor, kung tama ang payo niya, hindi kayo mamamatay sa cancer ng breast po.
And yeah, Doc, and if I may add lang, no, and kanina nakita natin yung facilities nyo, and I mean, I'm surprised na hindi naman pala ganun kamahal, okay? So basically, so kayo matakot. Kasi napakaganda na, well, your technology here is really advanced, and nagulat ako when I inquired on the different rates that you have here. And so ito mga kasangbahay na huwag tayong matakot, and you just book your appointments, and seek consult if kailangan yung makarinig. Okay, so you can get educated by Dr. San Agustin here, and they have like a medical group here at Asian Breast Center. Okay, so do you have any final words, Doc?
Yes, final word. No, please. The treatment begins with a knife but doesn't end with a knife, ano? Yung post-operative care ninyo, yung follow-up care ninyo, yung surveillance ninyo, yung mga preventions to keep it from coming back, yung mga nabanggit natin earlier here, napaka-importante po yung diet ninyo, yung activities ninyo, yung mental attitude ninyo, lahat importante po yun, no? To make it a really holistic type of medical care. Salamat po.
Yeah. Thank you very much again, Dr. Norman San Agustin. So, ito mga kasambahay, we hope na napakarami po kayo natutunan sa ating tinalakay ngayon. Pero hindi pa po nagtatapos dyan. Let's just pause for a short break. Doctors on TV, we'll be right back. Tayo nagbabalik sa Doctors on TV. Ako, syempre, bago po tayo magtapos, ay gusto po ulit natin pasalamatan ng Asian Breast Center sa pag-imbita niyo po sa amin at maipakilala natin sa publiko ang inyong mga pasilidad. At para po sa mga karagdagang impormasyon, panoorin po natin ito.
Asian Breast Center is a premier healthcare facility dedicated to breast health and wellness. It specializes in breast cancer diagnostics, treatments, and disease management, offering state-of-the-art technologies in treatment guided by American standards and guidelines. Visit their Facebook page at facebook.com/Asian Breast Center PH. The Asian Breast Center is located at the 8th floor of Centuria Medical Makati, located in Galayaan Avenue, corner Salamanca Street, Barangay Poblacion, Makati City. The center is open Monday to Friday from 9 a.m. to 4 p.m., except holidays. To get the best level of care, you can book an appointment by calling their mobile number at 0917-127-3278 or send inquiries through email ask.abc@asianbreastcenter.com. Breast cancer is curable and treatments are affordable when detected and diagnosed early.
And that brings us to the end of today's enlightening episode. But before we say goodbye, please watch this.
Watch these snippets for the upcoming episode on Sunday.
Sa mga kasangbahay, iniimbitahan po namin kayo dito sa Asian Breast Center para subukan ang makabagong teknolohiya na aming ini-introduce sa Pilipinas na thermalytics.
At yan po mga kasambahay ang aabakan natin sa susunod na linggo. And as we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their continued support. And of course, bago tayo magtapos, I would like to greet my kambal, Iyo and Iya, si Doc Alain, and of course, si EJ. Binabati din po natin ang ating mga pasyente sa Barba-Cabodil Health and Wellness Center. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, maraming salamat po sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
Special thanks to A&B Jose Antonio, Executive Chairman of Century Properties Group Incorporated. Mr. Jose Marco Antonio, President and CEO of Century Properties Group. Mr. Ray Di Maano, General Manager of Centuria Medical Makati. Ms. Ann Ramos, Sales and Leasing Manager of Centuria Medical Makati. Ms. Roxanne Carumba, Property Management Office Manager of Centuria Medical Makati. Ms. Reyes Pistaño, Operations Manager of Asian Breast Center Incorporated. Mr. Leo Angelo V. Santos, Transformation and Business Development Director of Asian Breast Center Incorporated. Asian Breast Center staffs: Jas Liagas, Carmela Marasigan, Janice Colina, Rose Lianza, Dia Castro, Cristel Domingo, Erica Matias, Elizabeth Gaston, Larissa Verzon, Alan Buncaras, Arian Exala, Aaron Balino, Bianca Santiano, Janiza Medina, Grace Valencia. We would like to thank Adlaon Optical, located at Grand Floor Super 8 Warehouse Poblacion, Baliwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Meycauayan City, Bulacan, 0922-861-2095. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Barba-Cabodil Health and Wellness Center, located at Unit 1531, Centuria Medical Makati, Century City, Makati. You may contact them at 0917-317-7272. For appointments and other inquiries about your health and wellness needs, please like and follow Facebook page, Dr. Sarah Barba-Cabodil. Dr. Sarah Barba-Cabodil would like to express her gratitude to Medical Depot, healthy num-num food. Where we do.